Diabetes affects the feet in a number of ways. It can damage the blood vessels because of the high sugar levels. It can cause the blood vessels to become hard, and even over time they can become calcified, meaning that rather than being springy and using muscles inside of the blood vessels to push the blood around, the blood vessels become caked in calcium, kind of like lime scale almost, on a normal household pipe. And because of that, as the blood vessels can't contract, they can't push blood around as effectively. This in turn can then lead to damage of the small nerves of the feet and even the bigger nerves eventually, because the nerves aren't getting the blood supply that they need. They're becoming starved of oxygen, and then as a result they're dying. There's also other chemical processes going on with uh, basically the sugar damaging and almost dissolving in a way the small nerve fibers. And then the other thing that can happen is that you get glycosylation of tissue, which is where the tissue, the flesh becomes sugar logged. If you imagine a towel after you've been to the beach, it can become kind of crunchy and crispy, and it's got all the sand stuck in it. And that's kind of what happens to the flesh on your, well, feet, and it can happen to other body parts too with diabetes. And then because of that, the flesh is a lot harder and it doesn't have the give, and as a result you end up with friction and pressure happening in a way that it didn't happen before. And then because of that friction and pressure and the hardening of the blood vessels, the tissue is not getting the blood supply that it needs, and then as a result that tissue dies. And so it's a kind of a self-propagating, a self-fulfilling kind of problem when you have diabetes, that everything else just starts getting worse as time goes on.